It doesn't really hurt, it just is uncomfortable and feels weird.
We've traveled down to the EpiCenter in Austell to meet up with Dr. Janet Memark, head of Cobb and Douglas Public Health, to talk about COVID and monkeypox and testing.
Yeah, so that's pretty good. So, we saw that earlier today that we were in medium transmission, and so we're excited about that. Hospitalizations are still high, so what I'm suspecting is that our transmission numbers have come down a bit, but we still got quite a few folks that are hospitalized with COVID. So, you can probably breathe a little bit of a sigh of relief, and I think what we're seeing is that numbers have plateaued and are starting to come down, and we hope will continue to come down. But we still got a lot of transmission out there right now.
So when you move from high to medium, should that change the way I act in any way?
I think at this point, not really. You probably can feel a little bit better that, when you are out and about. So maybe somewhere like here where it's a public place, but there aren't that many people milling around. So I feel comfortable not wearing a mask around. But if I go into maybe a crowded place, then maybe I would be a little bit more concerned about wearing my mask, and especially if I'm older or immunocompromised. So if I have some conditions that would make my immune system a little bit weaker, then I probably want to mask up. And you probably still want to do that when you go around in front of folks.
So as the director of CDPH, do you feel like we're moving in a good place with COVID now that we're medium? And I know you're concerned about the hospitals.
Yeah, I think we're moving in a better direction. And so what I hope is that we've got, unfortunately, enough people that have been infected that hopefully we will see this continued decline. But we've been on a plateau for quite a bit of time, and it's just slowly coming down. So I hope we're going in that right direction. But remember, this Omicron variant has the ability to reinfect people. So I'm a little bit concerned about what this new variant is going to bring.
Well, and then there's monkeypox. And there's been a lot of news about monkeypox lately, including one metro school district that has a case in the schools. So what's your advice to maybe parents and others who are concerned about that?
Yeah, so monkeypox, hopefully we are in a situation where we're more plateauing as well, and maybe those cases will start coming down as well. We've gotten a lot of high-risk people vaccinated, and hopefully we'll get more folks vaccinated as well that are also in a higher risk category, but probably not the highest risk. But hopefully we can get more folks vaccinated. As for the schools, that's a great question, and we've been seeing a lot of news around schools lately. I want everybody to remember, first of all, we have only a few pediatric cases throughout the whole state. So that's important to remember. And remember, this is not COVID. So this is not transmitted very easily from person to person. You need some direct contact, and right now what we're seeing is mostly like sexual contact. But if you have open rashes and then being exposed to those open rashes, that is what's going to put you at highest contact, not casual contact like being in a classroom. So just remember that. Even when we're investigating, if we have a case, we're going to look at the highest contact. So if they are in sports together, or for some reason if they're in a relationship or something like that, that's when you'd be a little bit more concerned, not just casual in-classroom contact. So please don't worry yourself too much about that.
We're not talking about wearing masks in school again or anything like that.
Not for monkeypox. So let's just hope that there aren't any variants of concern for COVID right now. So that's great, but we still have a lot of circulating Omicron. So, but not for monkeypox. We don't see that quite yet for masks.
I saw an article just this morning on the new vaccines coming. What are the new vaccines? What does it mean?
Yeah, so we're really excited about this new vaccine that's coming. Now, first of all, it is coming from Moderna and Pfizer, and it's the same technology as the other COVID vaccines that we've had. So we're going to hear next week and hopefully hear approval from the CDC on the approval of the bivalent vaccines. The Pfizer vaccine will go down to the age of 12 is what we're thinking, and then Moderna will go down to 18. What makes this vaccine different? First of all, it's going to cover the regular COVID that we've had, but because that vaccine has weakened against some of the mutations and variants, we're going to see now additional coverage of Omicron BA4 and 5. And so that is really the majority. I think about 90% of all variants that we're seeing of COVID right now is BA4 and 5. So what we're going to see, and this new vaccine is coverage for that. And so we're very excited. It's going to be coming along. Safety profile should be very, very similar to what we had previously with the regular COVID vaccines. And then hopefully this vaccine will help us out as winter comes and we're still battling BA4 and 5.
So we're down at the EpiCenter in front of a test and go Department of Public Health machine. I know you've said that testing's always very important when it comes to COVID, and that's kind of gotten a little bit of gray because a lot of people aren't even testing. Some use the private test. What would you like us to know about the machine behind you?
So we're really excited. You might have heard on some of these rapid tests, they're not picking up the variants as well. And you know, timing is everything as well. So sometimes your home test may not be as accurate, and sometimes you need to have a PCR test that's done. And so what we're really excited about is, you know, we all started off, you remember the mass drive-thrus, everything we started out with. We went from tickling your brain to now we can do this on your own. So this is a self-swab machine. It is free for testing, and you can do it at your convenience. And right now we're at the EpiCenter, and this machine is one of the pilot machines that have been put in place so that we can all try these out. You can get your results in less than 48 hours, and I'm hearing less than 24 many times, and you can come and just do this at your convenience. What you're going to want to do first when you come over to the machine, or if you're at home and you can pull it up, you're going to go ahead and go to the Test and Go website, testandgo.com, and get yourself registered for the test. And you know, make sure you kind of have your phone with you as you go through this. And so when you arrive, you have this QR code, and you're going to go ahead and scan your QR code. You can hear the machine working over here. All right. So, great. Okay, so we're going to go ahead and you got your Test and Go kit that comes right out of here. So we get this wrapper off. Now, so you open up, you have some instructions in here, and then they give you a pen to write your stuff on, and then here's your test tube kit. I was wondering about hand sanitizer, and here we go. We got some hand sanitizers that you can do before and after, and your swab, and your baggie here. So we're going to fill out the barcode label on here is the next thing after I got this box open and everything. And I'm going to be filling this stuff in. So I go ahead and I get this. I'm going to put it on my test tube kit. You're going to go ahead and you're going to sanitize your hands. Okay. And all right. So you're going to grab your swab, and you're going to see your swab has the tip portion down here, and then you got the top of the handle there. Now, it's very important. You got to remember to open it at the top of the handle and not grab it by the swab, right? Because you don't want to accidentally infect it. You're going to go ahead and pull it out, and then you're going to go ahead and swab your nose. And so what you're going to do is you're going to put it in your nostril, and then you're going to turn it towards the center of your nose. And it's probably about 1 inch for adults and ½ an inch for children. You're going to go around 4 or 5 times. It doesn't really hurt. It just is uncomfortable and it feels weird. Go to the other nostril. You're going to go in here, and you're going to swab 4 or 5 times around. And, okay, so now I'm done with that. And then I'm going to open up my test tube, and you're going to put it down in the swab area first, down, and then you're going to close up your test tube. All right? And then from there, you're going to go ahead and you're going to put it in your baggie. And then you're going to put your specimen bags, you're going to return it here in this box over here. Okay? And then you can return it right over there. So, you know, it's really important because, you know, as this continues, there aren't that many reliable tests that are really going to be pretty accurate, and these continue to be the most accurate of the tests that you can do, the PCR test. So, you know, you don't necessarily want to go to urgent care or the ER, and so this is very convenient to come in here and just grab one, do it, and throw it in there, and you can get yourself a really nice, accurate result. And this is at your convenience and no charge, so it's important that you can be able to do that.